Yeah, thank you very much, Jan, and welcome everyone on this morning to our presentation about the simulation modeling of OCD. Let's start with what is OCD. OCD is a complex psychiatric disorder which is characterized by persistent and intrusive thoughts, which we can also call obsessions. And in addition, you will also see repetitive behaviors or certain mental acts, so thoughts in the mind, that an individual can feel compelled to. So they have to do those things in accordance to a set of rules, and this then we call compulsions. Certain studies say that around 2.5% of the population will experience OCD or OCD-like symptoms at some point in their lives. This is a representation about the OCD cycle. So the example here shows, for example, hand washing. Someone can have the feeling that the hand washing is not completed. They still have all kinds of bacteria on their hands. That makes a feeling of anxiety, which results again in washing the hands, for example, which can be the compulsive behavior. After that, they will feel like a temporary relief, but it will be again translated to an obsessive thought, and in that way they will keep in this cycle, and it's important to break that cycle at some point. So causes of OCD, the exact causes are unknown. It can be a combination of factors, genetics, epigenetics, environmental risks, but recent research found a relation between epigenetics and OCD. And one part of epigenetics is methylation. When there is a methyl group added to a certain point in the genome, this results in less OXTR gene expression. OXTR stands for oxytocin gene receptor, oxytocin receptor. And when a part of the genome is more methylated, it will be resulting in less gene expression of that receptor. And that will result again in less oxytocin receptors. And oxytocin is an important neurotransmitter, which plays an important role in, for example, connecting social contacts and all kinds of interactions to the feelings of pleasure. And without that oxytocin receptor, there is less oxytocin effect. Yeah, it's quite difficult to say the exact cause of OCD, of the disorder, but there are several factors found in studies that may contribute to it. For example, childhood trauma and stressful life events. What's also found in the study is that the increased methylation of OXTR, so the oxytocin receptor gene, is associated with less activity in the parasympathetic nervous system during rest, which results in less capability to relax, and which can result in more feelings of anxiety again. So not able to relax will, for example, in this cycle, cause the person to be again going to the anxiety state. Possible treatments for OCD are things like psychotherapy, cognitive behavioral therapy, CBT, or maybe things like selective serotonin reuptake inhibitors. But there's a problem. Some studies found that hypermethylation, so more methylation of the OXTR gene, impact the effectiveness of cognitive behavioral therapy. So it makes it less effective. And therefore, we found it necessary to come up with a hypothetical mRNA molecule to restore the receptor functionality within our model. So having said all that, how did we do our simulation modeling? We have used the following methods. We used MATLAB 2017 and 2023 due to some errors with, for example, OptimTool. And to model to do our modeling, we used the adaptive templates provided by the course and by the course coordinator. And down below you can see the functions used within our model. I'll continue the next one, and I will give the word to Lotte.
Yes, thank you, Marco. So here you can see the conceptualization of our model. This is the model for the development of OCD. And in the base level, you can see some less opaque arrows, which are actually dotted, but the image is quite small, so they're less opaque. Those are negative connection weights, as well as the lines that are going upwards. And as you can see, there are two SS and SRS states. The lower one are SSS, which are for the normal day-to-day stress levels, and SST are for triggering stress. So in this case, it could be the childhood trauma. And as you can see, those lead to the preparation state for emotional response B, which is fear or anxiety. And that one is related to the feeling state, and those are the ones that have a connection upwards, so a negative effect on the gene expression. Also notice the threshold state on the first level. That one is connected to the anxiety state, so the FSB. And if you can click to the next one, Marco. This is the conceptualization of the model including therapy, so it's quite the same. For our second scenario, we added a therapy, a hypothetical epigenetic therapy, which is not there yet, but might be one day. Maybe you can click again. Then you see the explanation of all the states, and I would like to highlight some because there's a lot, and I hope you can read them. But there's one pathway from like the normal stress leading to some emotional response, the PSP, but also going to the PSA, which is the preparation stage for action actually, which is ESA, the execution state for response A, the behavior. Then we have the sensory representation state for the anticipated effect ESA. So that's what someone believes the behavior will, what kind of effect it will have. And what we will see when we run the simulations is the fact that there's triggering stress, so childhood trauma, leads to a negative effect on the OHTR gene expression. And oxytocin normally suppresses the excitability of the amygdala. The amygdala is the brain structure that's very important for anxiety. So when there's some childhood trauma and the OXTR gene is downregulated, or is the methylation, which Marco explained, oxytocin can do its work in suppressing the excitability. So what you will see is hyperexcitability. So the threshold is going down. So normally it's up. Oxytocin can do its job, but now when you see the epigenetic change, it will go down, which gives all the room for anxiety, and which results in the more obsessive thoughts and behaviors. So if you can click next. So this is the first scenario, the development of OCD with all the lines. On the next one, we removed some higher order lines, but I will first explain something, because from the time point 100 to 200, we use the step ones for the childhood trauma. So that's a longer period of time. And then you see up and down going SSS, so normal day-to-day level of stress, which, thank you, which we fill in with something like, you have to leave home for work, you have to lock the door, you have to check if you got your keys. So maybe if you can click next. The higher level states follow the most upper level connection weight, which is the lightest blue one. So as you can see, before the 100, there's no epigenetic change, and the threshold state is going up. So that way there is some behavior, there's a little bit of fear, you could say, some normal stress, like I have to leave the house, I have to lock my door, or do I have my keys, etc. And then if the childhood trauma occurs, you can see that the threshold is going down, and that the green line is that, and then the fear is going up very intensely. It's the blue one, and you can see that the behavior, the ESA, the yellow line, which in our case shows the frequency of behavior, is increasing a lot. And even if the childhood trauma has ended at 0.200, it's still there. The levels are very high. There's a lot of stress and a lot of repetitive behavior. Okay, click to the next one. So this is the scenario for the hypothetical epigenetic therapy, which you can see at 0.400. Again, these are all the lines, but you can already see that the higher level states are and at that point going up, and they are finding a balance towards the higher level. So again, yeah, a normal suppression of anxiety. And maybe you can click next. Here again, we highlighted some important lines. So the threshold is the green one again. So you can see that before therapy, it's almost 0. And then during therapy, it's going up. And then it's finding its balance, it's going down a bit, it's going up, and then it's going towards the value it had before the epigenetic change. The fear is extremely going down, and the behavior is showing more or less the same pattern as it had, or as it did before the epigenetic change. We are aware that the fear is going down quite a lot. However, there are more neurotransmitters and also more epigenetic changes that can occur in OCD. So yeah, we thought it's important to know that we are aware of that one. Okay, you can go to the next one. So we did some verification, and as you can see, there's quite a high accuracy. For almost all states, we chose some important states, so the fear state, the preparation state, the threshold state, and we chose different time points, but we were quite content with the outcome. And click next. And then we tried some parameter tuning for the validation or validation. However, as you can see, that MATLAB chose to just not let the OCD come up. So unfortunately, this is not very useful. So you see that there is some effect in the triggering stress, but afterwards the behavior is just going back to normal, as well as the stress levels, the fear levels, sorry. So yeah, it's not very useful. So we stick to our model. So this is the end of our presentation. Thank you for listening, and we were wondering if you have any questions or remarks.